Tehachapi and Lamont also remain open. In the next week, we'll be adding a mobile option for our farm workers. This is a partnership with the Good Samaritan Hospital out of Oildale and the California Farm Workers Foundation. And we hope that begins early next week. And again, that's mobile testing dedicated to our farm workers. Before I bring Matt up, I'm going to switch gears quickly to our Kern Recovers program. As of yesterday, we actually spent the entire $25 million for the forgivable loan program. The average loan was $29,400. We funded 806 businesses. The average time to fund them was 18.3 days. And we hit 238 industries, and that was almost 2 months to the day, so May 26th to July 22nd. We are having some internal discussions about what the future of that program looks like, and we hope to provide an update next week. As for the PPE program, that program is off to a great start. We have received 630 applications so far. We have delivered or distributed goods to 600 of those businesses, and their average wait time is between 1 to 2 days. So that program is working very well. We're excited to share that information. So now I'll bring up our Director of Public Health, Matt Constantine.
Thank you, Megan. This morning we are announcing that there are 1,135 new cases that we are reporting out today, and no new deaths. I want to speak briefly about the governor's most recent order. On July 13th, the governor announced that there were other businesses that were going to have to modify their operation because of the elevated numbers. That order did not apply to Kern immediately because we were not on the state's monitoring list for 3 consecutive days. Those changes that the governor ordered was to close the indoor operation of the following businesses: fitness centers, places of worship, offices for non-critical infrastructure, personal care services, hair salons and barbershops, and indoor malls. Now, Kern was flagged by the state as not meeting the metrics on Saturday, and then again on Sunday, and finally then on Monday. So as of Tuesday morning, the state placed Kern County on their monitoring list. And so therefore the governor's order, we believe, will apply locally in Kern County tomorrow morning. We will await formal notification of the governor's order and its applicability in Kern, but we believe it will be applied to us tomorrow morning. I also want to talk about our ambulance providers in the county, in particular Hall Ambulance. Over the last 10 days, Hall Ambulance has been talking to public health about the impacts that COVID-19 has had on Hall's ability to provide the services that they're under contract with the county for. Hall has transported, they tell us, more than 1,000 COVID positive or suspect patients, and every single transport they need to make sure that they clean the ambulances thoroughly. That takes upwards of 5 hours to complete. They are incurring record numbers of calls. That call volume is high, and they're again experiencing some extended offload times. The time in order to offload the patient and entrust that patient to the care of the hospital, that is extended. Because of those constraints that they're facing, there's some actions that Hall Ambulance and Public Health is taking to try to assist. Hall Ambulance has contracted with Liberty Ambulance out of Ridgecrest to ensure continuity of services. Last weekend, Liberty Ambulance provided some assistance both in Metro Bakersfield and in Eastern Kern. Beginning July 26th, which is Sunday, Liberty Ambulance will be under contract to provide ongoing coverage for the time being in Eastern Kern to assist. And tomorrow, the state is deploying 2 ambulance strike teams to Kern County, and they will be posted here through the weekend. Each strike team consists of 5 ambulances and 11 staff members. So there's 2 strike teams coming, and they will be posted here and available for our use if the demand requires. We also received notification from Kevin McCarthy's office about his ability to obtain a commitment from the federal government, from the U.S. Department of Health and Human Services, to provide additional testing in Kern County. Last night, I had a couple brief conversations with Kevin, and he has indicated that a little bit more detail. The federal government is going to be contracting with a company called True North. They will be able to be deployed and establish surge COVID testing here locally. The proposal is somewhere between 1 and 3 sites. They are working with the state for approval. We know that we believe at least 1 site has been approved. Their objective is to test 60,000 people. The unique nature of this testing site, though, is they're able to deploy quickly, set up very quickly, and they come with their own mobile lab. So and they've indicated that the turnaround time in the lab should not exceed 48 hours. So that would be a significant benefit to us. We are grateful for the help. We're going to wait further information before we have any announcements, but that is working now behind the scenes. So that's good news. And then finally, we've talked about hospital staffing routinely as a limiting factor that we face in Kern County. The state tracks available beds and available ICU beds. We track those numbers locally also, but as we have learned, staffing, ICU nurses in particular, are the limiting factor. So on July 28th, next Tuesday, there will be a board item seeking retroactive approval to allow the county to use federal CARES money to help augment staffing in our local hospitals. This is an agreement that the county will have directly with a staffing agency, and then those nurses, up to 84 ICU nurses over time, will be allocated initially to Kern Medical, Heart Hospital, and the Dignity and Adventist hospitals. That item will be up for discussion on Tuesday, but we are anxious to obtain that additional resources and deploy them quickly. So with that, I'd like to introduce Russell Judd, the CEO of Kern Medical, and ask if he could talk a little bit more about staffing and some of the hospital constraints.
Good morning. As Matt mentioned, I'm Russell Judd. I'm the Chief Executive Officer of Kern Medical. Let me first express our appreciation to Matt and to county leadership and to the Board of Supervisors for engaging the hospitals in this very important discussion to ensure that we have the needed available space, hospital beds, to meet the needs of our community. As a hospital, there's a lot that goes into caring for a patient. You need space, you need equipment, you need medications, you need supplies, and most importantly, you need people. Healthcare is a service industry. It is people who care for people in a desperate time of need. And so as we have been preparing for the many months for this increase in this COVID crisis, each hospital has prepared surge plans. We were asked very early back in March by the state of California to put together plans to grow for 20% and then to increase an additional 40% of our licensed capacity to provide care for a surge of patients. We put most of those plans in place, and as we all know, the surge didn't happen then. What we thought would be in March or April is now upon us in July and August. And so with the increased number of disease in our community has led to a significant increase in the number of patients who are hospitalized. That number continues to grow. All the hospitals are at the point of max capacity, and we're now beginning to implement these surge plans to be able to care for the people in our community. This agreement that Matt referenced is a commitment that the county has come forth to allow us to staff above our ICU capacity. Each hospital is committed to ensure that there's enough, mainly nurses and all the other that goes with it, to staff up to their licensed ICU beds. This is now to take us over that licensed capacity into this surge. Of course, these plans have to be communicated to and approved by the California Association of Public Hospitals. We notify them when we go above our licensed area. There's many regulations that we're aware of and that we follow and that we communicate with the state with. But this contract with this registry allows us to recruit and bring into the community these additional, particularly we're focusing now on ICU nurses. They don't live in our community. There's not enough RNs who live in Kern County to provide this level of care, and so you contract with this staffing agency. They're actually a broker, and they will go out and sign subcontracts with dozens, if not even hundreds, of other nursing staffing agencies to provide the staff. They will come from all over the country. Their wage is extremely high, sometimes in excess of triple what you normally pay for a nurse. However, we're securing this now in anticipation of the continued increase in the number of cases. We are firm believers that if we waited until the crisis hit and we got to the point where we had to have them now, there would not be any nurses available. We will be drawing upon the pool of nurses that people from other parts of California will draw from, people from Texas, from Arizona, from all over the country. There's a limited supply, and we want to ensure that we're securing the needed staff in anticipation of this growth. So it's great foresight on the county in partnership with the hospitals as we plan for the future to ensure we're not just able to meet what the demand is today, but what the demand may be in October, in November, as we see this increase. If we don't see the increase, if a vaccine is developed and or the disease runs its course, then yes, resources could have been spent that may not needed to, but the alternative is a much greater risk. Much rather to have the staff available than to put ourselves in a situation where individuals need care and it cannot be provided. I should mention, right now we're focused on the ICU. As Matt mentioned, with the hospitals identified, we are looking to expand that to the other hospitals in the community, some of the smaller and more rural hospitals. We will be now, next phase is identifying how we provide additional staffing for them so that they're able to also handle the increase of patients that we know will be forthcoming. So again, I want to express my appreciation on behalf of all the hospitals for the county using these funds. It's a great use of these funds. It is very expensive. The hospitals, yes, they receive a reimbursement for caring for the patients, but the cost of these nurses is well beyond what the reimbursement will come from insurance companies and the federal government. These funds that are coming from the county are being used for the public good. They'll be used to treat people who have no insurance or are underinsured and where the costs are not covered by insurance. So we are working to be prepared. We recognize our very important role of ensuring that when people need hospitalized care for this disease, that resources and space is available to meet that need. Thank you.
Thank you, Russell. So now we'll switch to taking questions. A couple of reminders. We're going to ask our reporters to keep their questions to the subjects we covered today. We know there are a lot of other questions that you may have, and both myself and Michelle are happy to help you with those offline. We'll call on you in the order that was provided to you earlier today. Remember, it's *6 to unmute. And our first outlet is Valley Public Radio. I believe we have Carrie on the line.
Yes, hi, good morning, thank you. Carrie Klein here. I appreciate all those details. Actually, my main question was about more of that plan about the nurses you were bringing, so thank you for information about that. I was also wondering at last week's meeting, I forget if it was Ryan or Matt, but you had explained why case counts were likely to rise so sharply this week, and they did. Can you repeat again why that was happening?
We'll have Matt answer that one for you, Carrie.
Carrie, good morning. I'll repeat what I had stated. Kim might have some more details for you. We had a number of issues come forward. We had observed quite a significant increase in testing beginning in July. In fact, the sites that we monitor very closely showed significant increases. Fourfold increase in many of the locations was observed, if not more. We also were notified of extended turnaround time delays by the two main labs that are used, Quest and Westpac. They both indicated a shortage in supplies. One had a shortage in testing material, another had a shortage in reagent that's used in the lab. They've also both indicated that their turnaround times would be delayed even up to 2 weeks. And they have also indicated that if needed, non-priority tests, meaning asymptomatic individuals, their test results may actually be held until the turnaround times improved. That aligned with the California Department of Public Health. They released a document that prioritized testing so that those that were symptomatic or essential workers or healthcare workers got preferential treatment so that they got the results back quicker, and asymptomatic individuals that are otherwise healthy were to expect longer delays. So both of those issues combined to really create an environment where we recently have realized the labs are sending in batches of results in high numbers, and that quickly overwhelmed our staffing structure that was established to be responsive to the number of lab reports we were getting in. So we've had to adjust, we've had to retrain, we've actually tripled staffing in some of the critical areas. It took us a couple days to get that. So it was really those two issues that caused some of this concern, both the increased demand in testing and then the extended turnaround times from the lab. Carrie, did that answer your question?
I think so, yes. Let me just clarify. So even though disregarding any backlogs on the testing side, they were sending in lots of testing results to the county, and the county wasn't able to process them as quickly as the lab was sending them in. But now you've reorganized your staff so that you can.
Correct, Carrie. So as we observed sort of unexpectedly these large numbers of tests coming in, the staffing that we had established previously was inadequate. So we have to not only train individuals, they have to be approved by the state so that they can access the state database. That takes a little bit of time. So it took us a day or two to reconfigure and adjust and get state approval. But those systems are in place today.
Okay, got it. Thank you very much. That's it for me.
Our next outlet is Channel 29. I believe we have Tim on the line.
Hi, guys. Yes, I am here. Mr. Constantine, you mentioned the second round of shutdown, I guess, for lack of a better term, starting tomorrow. Now, how much of us getting back on the state's monitoring list was due to that backlog? I know we also mentioned the rising hospitalization rate last week. Was it a combination of the two? Was it primarily due to the backlog of tests? What is it in your view?
Good morning, Tim. So the state's metrics that they use on that monitoring list website is delayed. And if you look at that website, you will see that they take averages. Some of those categories are averaged over 7 or 14 days, if I recall, and some of them have a lag of 7 days. So they are looking at data that is older. I can't quickly tell you to what degree some of those increased test results had an effect. As you know, some of the metrics are hospitalization rates. That wouldn't have been directly affected because those hospitalizations likely had occurred. But testing positivity and the case rate would be affected, but it is delayed. So the state has that pretty complicated formula on their website, and it is explained. There might have been some influence, but certainly going forward, there would be also some influence from those higher numbers.
Right. And we've been hearing from a lot of businesses that, they spent the time, they spent the money implementing the new mandates coming down from the governor with your guys' help, obviously. And now it seems like we're back on this monitoring list because of the backlog, which we really didn't become aware of until about a week ago. I know it's relatively new to you guys, too. If we manage to get off that list, a lot of them have been asking us, how do they trust that we won't have another backlog or that this backlog will actually get sorted out so if they reopen again, they won't get shut down again?
Yeah, thank you, Tim. So I don't think it's correct to align the lab delays with being on the monitoring list. I understand your statement, and the effect on our local businesses is severe. And it is unfortunate that many of these businesses implemented and appropriately implemented controls to address the spread of disease. And now the governor's order says that we can't do any of those services indoors, and we have to do them outdoors, which in the Central Valley is just probably not applicable in the summer months. So it is a challenge for our economy and our local businesses to keep abreast of the changes and to constantly adjust. And, not only, it's not as easy as just opening one day. We're talking about staffing and ordering resources, and that's just a really difficult environment to maintain. And also, Tim, it's important to note that unlike before, the governor's order does not allow us to come off of the monitoring list and then come off of the orders and allow those businesses to reopen. I think it's about 80%, if I last looked, of the state is covered by these new orders, and the governor's indicated we will come off together, not individually by county. Hopefully that answers your question.
It does. I have a question about the surge testing with the congressman as well. I know that'll up our testing capability. Will that also include resources to up our processing capability? Or if we have more tests coming in as a result of this funding, does that mean that this backlog will just get larger and larger?
So the difference and please keep in mind, this is all new. We don't have a lot of detail.
Right, absolutely.
But from what we understand, the surge testing that Kevin McCarthy has been able to obtain comes with their own mobile lab, is what we've been told. And they would not be dependent on some of these contracted labs. And they indicated a 24 to 48 hour turnaround, which for a public health standpoint is fantastic, but because it allows us to intervene quicker. So hopefully we're not faced with a similar situation, but it does not come with additional resources that we're aware of. We obviously would be impacted by it, but that's what we need to do. Testing is one of those three fundamental aspects. You got to test people, find early identification, ask that they isolate, and then do that contact tracing to look for others that may have been exposed. So it's really the cornerstone of what we do, and we're grateful that there is the potential for expanded testing.
Right. And my final question, if we have the time, is I know Mr. Alsop and a few others of you guys up there have said that they've been quite happy with how businesses have implemented, all the changes that have come down, and obviously a lot of them have done a sensational job. But it seems like our efforts collectively haven't been enough to, again, keep off the monitoring list, to keep off the shutdown list. Are you guys still happy with the way that we handled this as a community, or, it seems like we failed?
No, Tim, I don't share that summary. Unfortunately, the numbers are higher. This is what the model has predicted. This is what happens in communities. But I think we've made a difference. I think we have flattened the curve. I think our businesses have done a fantastic job. People are listening. They're understanding that by wearing a mask yourself, you're protecting others. You're helping protect that person that's selling you food at a grocery store, or handing you food at a restaurant, or, providing one of those essential services. You're protecting them by wearing that mask. So I think we have done a really good job. It's been we don't face pandemics like this very often. So there's a lot to be learned, but I think we're doing well. And it's important that we don't stop, right? We need to continue the efforts. We need to make sure that Russell's hospital and his colleagues' hospitals remain healthy and they have capacity. So we need to do our part and to continue to heed those warnings about wearing a mask and staying home when you're sick and just being cautious about what we do.
Thank you for your time, guys.
Thank you.
Okay, our next outlet is Channel 17. I believe we have Eitan on the line.
Yes, that is correct. Hey, everybody. Eitan Wallace here. I'm going to go right to the question, and I believe it's for Mr. Constantine. The question is, based on what you said earlier, Mr. Constantine, what can we expect tomorrow? So what will be closed, and is there any way you could be specific in the sense of, for instance, Valley Plaza Mall or hair salons, et cetera?
Do you have?
I do have a list,
Okay.
yeah. Eitan, good morning. We are still awaiting the governor's order, so we need to preface our comments based on awaiting their formal notification and the order on Kern County. So just again to go through the list, fitness centers were identified by the governor. No indoor fitness centers should be open. Places of worship, churches in particular, not allowing indoor services. As Ryan has mentioned before, indoor protests are on the list. Offices for non-critical infrastructure. So this is the list that the governor put out months ago that we used to reference. So those sectors are identified on the governor's website as critical and non-critical. So those offices related to non-critical for indoor could not be open. Personal care services that goes into detail about massage, nails, and hair salons and barbershops are also listed, not allowing indoor services. And then, as you mentioned, Eitan, indoor malls are listed. So I think we will go through that and try to apply it locally because there is confusion. But that's what we do. We have a call center ready to take questions. We have a group of people that are accessible, that help to interpret this, and so that we can help our businesses make these important decisions. Is that responsive to your question, Eitan?
Indeed, Matt. Thank you very much. And just a follow-up there, as far as you know, anything about like retail stores, like in outdoor areas like the Park at Riverwalk or yes, the Park at Riverwalk?
So we'd have to go through the list, but without a specific business name, I can't answer the question. But if it didn't fall into one of those categories, then the governor's order wouldn't apply.
I see. And the governor's office, as far as you know, in terms of a timetable, is it impossible to make a? But here, I guess, if it is impossible to make a prediction as to when the governor's office will get back to you, at least is it that once they let you know, will you then make a public announcement?
Yes, sir. So what has happened previously is the state has issued media advisories. We then take that order and whatever the state puts on their website, we will put on our website, and we will certainly make that publicly available.
Thank you. And just following up again, in terms of preparing, if a business is, let's say, on the unsure about whether they are in fact on this list or not, how do you recommend they best prepare?
If there's any confusion about any of those categories, we're here to help. So if they want to call public health, and we can happily try to interpret. The California Department of Public Health and the governor's office is also a resource, but I think we can provide you a quicker response. And if you just call public health 661-321-3000, we will do our best to interpret it and get you some guidance.
Much appreciated. And my last question, I believe, is from Mr. Judd. I just want to quote him, if it's okay, very quickly. He said, quote, "All the hospitals are at the point of max capacity." Mr. Judd, are you saying that right now that's exactly what's happened? All of the hospitals at the point of max capacity, or are you saying you're preparing for that point?
Thank you for the question. Hospital staffing is a very difficult element because there are significant ebbs and flows by time of day, by day of the week, and what happens in healthcare. So my statement about max capacity is we hit that off and on over the last couple of weeks. What is happening in a hospital right now is not what's going to be happening 12 hours from now, and not what happened 12 hours prior to that. So it's very hard to say when a hospital hits max capacity. We deal with this on a regular basis. At Kern Medical, being the trauma center in the community, we could have a significant motor vehicle accident, so where 10 patients are brought in, for that little bit to figure that out, yes, we're at max capacity. So this is a very general statement. It's an overall trend. What is an accurate statement is the number of COVID positive patients in hospitals continues to increase. And the larger number of patients that we have with COVID means it taxes our resources. And so it is hard to say at any given time when we on or off, but we do know that there's more patients, there's sicker patients, and so we need to prepare to be able to care for that increased number. Does that answer your question?
Yes, indeed. Thank you, Mr. Judd. Thank you, Matt. Appreciate that.
Our next outlet is Telemundo. I believe we have Norma on the line.
Good morning. How are you?
Doing well, thank you. How are you?
Good, doing good. I have two questions only. One of them pertains to the numbers on the dashboard. Today, 40%, a little bit over 40% of the people that tested positive are Hispanics. I'm talking about the race and ethnicity numbers. But then we have 44% under unknown. What do you mean by unknown? Is it because they left blank that part, when they filled out the paperwork? Or are we talking about a totally separate group of people?
Norma, we're going to have our lead epidemiologist, Kim Hernandez, respond to your question.
Okay.
Hi, Norma. Good morning. With the race and ethnicity data on our dashboard, race and ethnicity data is not always something that is collected and reported by the laboratory reports. So that does come up when we are contacting and communicating with our patients in order to get that information filled out. Some people do decline to report their race and ethnicity, but for a lot of the ones that are unknown, we are still waiting to hear from responses from patients. We are still reaching out to contact them so we can verify the race and ethnicity and get it updated on our dashboard.
Okay, so that could bring up the numbers that we already have, the Hispanics and the other ethnicity groups, right?
Sorry, Norma, will you repeat that the first part of your question?
So this percentage of unknown ethnicity groups that could bring that once you get the information, that could bring up the numbers on the Hispanics and the other groups that are identified in the dashboard, right?
Yes, absolutely. As
Correct.
people respond and let us know how they identify, that race and ethnicity will plug into the dashboard, and those unknowns will move into their respective categories.
Okay, thank you so much. I have another question, and this pertains to the services that hair salons would be able to provide outside. So I don't know who could answer that. I just want to know, once they are permitted to operate outside, are they still going to be able to do shampooing, permanent waving, bleaching, tinting, coloring, and dyeing outside?
So, sorry, we're trying to figure out the answer. Hang on one second.
Norma, good morning. That's a great question, because we had the same questions for us from an environmental health standpoint about how you can provide some of those services outdoors. We don't have clarification yet from the state beyond the fact that you can't do those services indoor, but you can do them outdoor. Our concern is that provides a little bit of a challenge for both the people that are coloring hair, and how do you do that outdoors? That presents some challenges. So the California Department of Public Health has said that it's allowed. How that actually functions and how we ensure that we're removing trash or liquid waste or the chemicals that are used is a concern. So we want to make sure that's done carefully, and that presents a little bit of a challenge outdoors. So we've asked for clarification, but we don't have it yet beyond the fact that they say, yes, it's allowed outdoors.
Okay, and the last question is this. Before businesses were able to operate inside, after the closure that we had a few weeks ago, they had to have permission or authorization from the Department of Health. Is that going to be the same case for those businesses that are now going to be able to operate outside? Are you guys going to have to give them a new authorization, or is there going to be any type of monitoring to make sure that they're complying with all of the rules?
So Norma, I got
once they are outside.
I'm sorry, go ahead.
Once they operate outside, I'm talking about.
So Norma, I understood the second part of your question. I'll answer that, and then I'm going to need clarification on the first part. The county's role in this, on the governor's order, is to make sure our businesses are aware of the restrictions, to help them interpret and understand. If there are guidance documents the state has issued, we want to make sure that they have them and they understand the need. The county is providing PPE when needed. But our job is to make sure you're aware and tell you the importance. The county is not enforcing. The state, though, has established a strike team that is comprised of different state agencies. We understand that anybody that has a state permit and the reference state agency could enforce the governor's order or these COVID restrictions, along with the normal inspections and compliance that people have to achieve. So the strike team is in force and has been doing work in California, but at the county level, our job is just to educate and increase awareness. And Norma, could you help me understand the first part of your question again?
I think you already answered, with the second part. I was just saying that after the first closure, when businesses were able to reopen, a lot of them had to have authorization from Kern County Public Health. Okay, so I just wanted to know if after the governor confirms our status, will they be able to just move the operations outside, obviously following the guidelines, without requiring any extra authorization from the Kern County Public Health Department?
Got it. Okay. So first off, let's clarify. There's no authorization needed from Kern County Public Health. This is a governor's order. He is placing this on Kern County. There's no authorization allowed or given at the local level. So I think to specifically answer your question, if the governor's order indicates on Friday that a business must shut down indoor services, then they must follow that. There's no further authorization or approvals needed in order to comply.
Got it. Thank you.
You're welcome.
Our next outlet is KUZZ. I believe we have Rob on the line. One more time, KUZZ, I think we have Rob on the line. It's *6 to unmute. Okay, we'll keep going. If you're there, you can come back later. Bakersfield, California, and I think we have Sam on the line.
Yes, Megan, thank you. How are you doing today?
Doing well, thank you.
So my question is, does anybody have a sense of how Kern County compares to the rest of the state, especially in terms of the ratio of people infected compared to the population? Basically, I'm wondering, is this county now, among the highest in the state? Are we a hotspot?
I think we're going to have Kim respond to that. Eitan, just give us a second.
Sam.
Sam, sorry.
Hi, Sam. We are seeing increasing, rates locally as well as throughout the state of California. You can follow the numbers throughout the state. And so this is something all of our communities are grappling with, particularly in some of the smaller counties where people live in one county, work in another, and may, recreate where they can in a whole different county. So as a state, we're all going through this. That's partly, our understanding of why the governor is directing a lot of what's going on so that we can continue to move as a state. So we aren't seeing while we're seeing increasing cases in Kern County, our neighboring counties are also facing increasing casing. So we're all working through this together, and we continue to encourage all of the people in our community to follow the recommendations, to do whatever they can to help prevent transmission of COVID-19 so we can continue to protect the most vulnerable in our community.
Okay, thank you. And my follow-up question is just, I'm wondering how accurate it is to attribute the rise in cases to a backlog. It just seems like there just is more of the coronavirus throughout the community, regardless of whether or not it's taking longer to get the test results back. So would you say that, just in general, cases have increased and, despite the delay, we're going to continue to see elevated daily reports from you guys?
Yeah, we're going to have Kim respond.
So, Sam, you're correct in that we are seeing increasing cases in Kern County. With slower turnaround times with the labs, it makes it a little bit more difficult to do the interventions we would hope to do. For example, if we could tell immediately on every person that they had COVID-19, we could tell them immediately to stay home. They could immediately notify the people in their lives who are close contacts. As that time spreads on, there's a risk if that person isn't staying home because they're not known to be positive and they maybe don't think they're positive, haven't had symptoms, they could potentially be spreading it unknowingly while they wait for their test result. So we do encourage people who are being tested for COVID-19 to isolate and stay home and to reduce their contacts with others in case that result comes out positive. We do know that we are seeing more and more people who are being tested, and we are finding more and more positive results. Those are, while we don't wish for increased transmission in our community, we know that finding the people who are positive so they can isolate, so we can make contact with their close contacts, to have those people quarantine at home and watch for symptoms so that if they become sick, they don't spread it to others, that is an important part of reducing transmission in our community. So while we do expect to continue to see more cases, we continue to encourage people to take every effort to reduce the risk of transmission, to stay home unless you absolutely need to be out. When you're out and about, to stay 6 feet away from people, to limit your time and your contact with others, And so that you don't inadvertently pass it to someone, or that you don't inadvertently pick it up from someone. And so we continue to encourage our community to do all of the things that they've been doing, and we are grateful for all the steps that have been taken by our community members, by our businesses and our industries in order to continue to protect everyone in our community.
Okay, thank you very much.
Thanks. Our next outlet is Kern Radio. I believe we have JR on the line.
Yes, Megan. Good morning. Thank you.
Good morning.
My question is about staffing. 2 weeks ago, I asked about staffing for contact tracers and the incoming caseload and was told we were in a good position. Kind of turns out we weren't, but where are we in regards to staffing now with contact tracers? But more importantly, how far are we behind? What's the backlog in contact tracing? My sources tell me we're about 3 weeks behind.
We're going to have Kim respond to your question, JR.
So we are, as Matt has mentioned earlier, we have actively been bringing more people into the contact tracing process. You know, there are a lot more people behind the whole system than just the one person on the phone. And so we continue to increase that staffing to respond to the number of positive test results that we are getting. We are trying to reach out to people as quickly as possible. We know many people have been reaching out to us as well. And we want to make sure that we continue to assess our community and that we are able to talk to them. We know that in addition to the laboratory reports we're getting and the healthcare priority reports we're getting, some patients are tested out of county. Some patients are being tested at labs that are out of county that take some time to get results to us. So we do reach out as quickly as we can. One of the things is sometimes the missing information. We're looking to get that information so we can reach out. We appreciate all the people who have been reaching out to us at Public Health so we can respond to them quickly. So that's what we would encourage people to do if they have concerns. We know that in most cases, you know, in all cases, the patients are going to hear that they are positive from the person who tested them before we hear about it at Public Health. And so as we get them, we are sending them immediately out to staff who work 7 days a week in order to make contact with all of the patients we can in our community.
Okay, my next question. I'm also told from staff at local hospitals that they're dealing with what's called an internal crisis. Some are even having to sign confidentiality papers, and that one or more hospitals reached capacity within the last week or so and had to again divert patients to other hospitals, even some out of the counties. Has Public Health received any such notices from local hospitals?
JR, I'm getting a no from the side, so it doesn't look like it.
So no hospitals have reached capacity within the past week and had to divert patients?
No, all three of the experts to my left are saying no.
Okay. What is our current hospitalized patients in ICUs?
We're going to have Kim pull that number. It'll take us just a second. And what we'll do
is the state strike force in Kern County currently?
I'm sorry, JR, the microphone got really muffled. Can you try that one again?
Is the state strike force that is enforcing since the county isn't, are they currently in the county right now?
We don't know if they are, but we don't believe so. And it looks like Kim will be here in just a second with the data. She's coming up. Give her just a second.
Thank you.
Matt's going to respond, so give us a sec.
JR, good morning. I think you asked about the number that were hospitalized. So the state is reporting in Kern County there are 270 COVID positive patients that are hospitalized and 66 in the ICU. Does that answer your question?
It does. Thank you. And then, Matt, you could probably stay up. I think Norma was trying to ask, is maybe the county, I know the city was requiring permits for restaurants to move outdoors. I believe she was trying to ask, are you guys going to have permits to move outdoor salons?
So, JR, no, to my knowledge, we would not. We would want to think that through with our local planning and building departments. Initially, the outdoor seating component was of interest for our local planners and building departments to make sure that it didn't impede traffic flow or sidewalk traffic, and the tents were secured. So I am not aware of any additional local requirements. It depends on what they would want to set up and kind of how they would like to achieve that. I would assume if there are canopies or tents that they want to establish that are large. I know that the fire department and building departments may have some involvement. They just don't want them blowing away or landing on somebody. They want them secured. So depending on what they would propose, the local planning and building departments would help. They have established an expedited process, both City of Bakersfield and the County of Kern, to get businesses through that extraordinarily fast so that we don't inhibit any business. So I would assume if needed, that same approach could apply.
Thank you.
Our next outlet is Channel 23. I believe we have Tori on the line.
Yes, good morning.
Good morning. Go ahead.
So my first question is about the backlog in cases at the labs. Obviously, this has been the center of the discussion this morning. But can we get a firm date, or at least an area like mid or early June, on how far back these testing dates are going right now in terms of the number of pending tests still? Like, is it as far back as mid-June or early June?
Tori, we're going to have Kim respond.
At this point in time, Tori, we're into July, so we do still have some that are coming through that have specimen collection dates from early July, but they aren't back to May. It was in the beginning of July when the labs were receiving an overwhelming number of tests. They had to bring on more lab capacity in order to process them, and so as they were able to do that, then all of these test results were dumping back out to us. And so the logs are, we do still see a few come through that are from the beginning of July, but we're not back in May or June anymore.
Okay, is the number on the dashboard right now in terms of the number of pending tests being at a little bit more than 2,700? Is that accurate?
We'll have Kim explain that.
So the pending tests on our dashboard is the tests that have been received into Kern County that need to finish being processed through to determine, to ensure that they are indeed Kern County residents, that they have been, that they are positive and negative and they are the correct test results. And so the pending test category on our dashboard doesn't reflect all of the specimens that are at the laboratories waiting for test results. And that has sort of evolved over time. The pending tests that you're seeing on our dashboards are the ones where we have test results, but it's missing patient information, and we have to confirm that it is indeed a Kern County case, or that is, there are also negative results in that pending test to make sure that those are indeed negative results or positive results before they move into the negative or positive category that's on that place in the dashboard.
Okay, thank you for answering that. So you guys mentioned, obviously, thank you for the update on the mobile testing site for our farm workers. I know that that's obviously been an area in our community that's been very concerned. The Central California Farm Workers Foundation said that they were under the impression that the mobile testing site was actually going to be rolled out tomorrow. You guys obviously just mentioned that next week is when we're going to see this mobile testing site land in the farm workers' hands, but do you guys have an accurate day, just because they were really anticipating Friday, which is tomorrow? Do you guys have a day of next week that we can pass along to them?
We don't have a specific day. We're hoping early next week. We're in the process of finalizing contracts. So as soon as those are done, we'll be able to get started. And I'll make sure, Matt, no, okay, we're good. Yeah. So hopefully very early next week.
And you are listening to live comments from the Kern Public Health Department. Again, the first press conference in a week. We're going to have a recap for you coming up at 11 a.m. Stay with us.
Amen.
I'm
Cami Lang with Save the Girls Touchscreen Purses. It's a purse company where you can do all your smartphone functions right through the backside of your purse. And we are so thankful to bring to the view today 50% off some of our top styles, including great summer items like our eyeglass purse. Everything is 50% off. Thank you for helping a small business.
Before we go, we want to clarify something that was said before. News reports show that Fred Trump was detained at a KKK rally in 1927, but there is no evidence that Trump's father was a member or supporter of the KKK. Someone named Trump was detained. We don't know if it was his dad or not. So that's what we're clearing up. We want everybody to have a great day. We want, I just read what they gave me. Everybody to take a little time to enjoy the view, wash your hands, brush your teeth, make sure you don't have bad breath, and don't be a sitting pineapple.
This Coke could be the first one you're having at McDonald's again. This iced coffee could be the first one at the same old time. And this slushie could be the first one you're having with friends. Whatever this order is for you, we'll be here to take it.
Stay cool this summer with your favorite frozen flavors. Get a medium frozen drink for $1.50, a small Minute Maid slushie for $1.50, or any size soft drink for just $1.
When looking for a TV and internet provider, we know you have a choice. This is Jessica. She still has satellite TV.
Well, I get tons of HD.
Spectrum has tons of HD. And we get exclusive access to premium original content with Spectrum Originals.
I don't have that. Plus, sometimes in the rain, our services go out.
Because of the dish on your roof?
Get Spectrum TV from $44.99 a month. Call 833-916-4499.
And Spectrum Internet starts at 100 megabits with no data caps and a free modem.
We have to get internet from another company, and it isn't nearly as fast.
Spectrum Internet, $44.99 a month.
I'd switch, but I'm stuck in a contract and would have to pay up to $480 to cancel.
Spectrum has no contracts, and they'll pay up to $500 to help you out of yours.
That's it. I'm switching to Spectrum.
Get Spectrum TV and internet from $44.99 a month each. Call 833-916-4499.
We're open, Kern County, letting you know what local businesses are still open to serve you. Sponsored by these fine sponsors.